friends, welcome to Nephro Podcast brought to you by RBG Life Science. Today we have with us Dr. Tanmay Pandya sir. Dr. Tanmay Pandya sir is from the New Delhi. He is a head of HOD of the Department of Nephrology, Kidney Transplantation. We have some questions, we have some doubts, myths and facts regarding kidney transplantation. So we are going to have some questionnaire with sir. So sir, hello sir, welcome to podcast.
Thank you.
So doctor, what is the exactly kidney transplantation means to the patient?
See, basically, in some patients, there is a condition called chronic kidney disease.
Okay.
And when this progresses inexorably, it eventually leads to something called kidney failure. No, in simple terms, that is a condition when the patient's kidneys do not perform the basic task of purifying the blood, removing toxins, balancing blood pressure, electrolytes, fluids, etc. And you need to replace the kidney's function. Now, when you come to replacement of kidney function, you have one option, dialysis, and another option is transplantation. So for these people who are requiring kidney replacement therapy on long term, transplantation is the treatment of choice, wherein surgically a donor kidney is placed in the recipient and that kidney works like a normal kidney for all practical purposes. That is kidney transplantation.
So sir, for whenever the patient is coming for the kidney transplantation, what parameters you monitor that you are agree that patient is ready for the transplantation?
Okay, so in general, everybody who has kidney failure is potentially a transplant recipient. I mean, can go for a kidney transplantation. There are some conditions that should, not be there in the patient. For example, the patient should not have any malignancy, or that is cancer, at least no active cancers. If a patient had a cancer in the past, patient should have been properly treated and cured and should wait for 2 to 5 years for cancer. Patient should not have any other significant organ failure. For example, patient should not have liver failure, heart failure which is not treatable, lung failure, because that will not allow the patient to have the benefit of a kidney transplant. Apart from that, patient generally should not be very old. There is no medical contraindication, but older people tend to be frail, that is weak, and they may have more complications. But apart from that, almost everybody can go for a kidney transplantation, provided they have a suitable donor.
Like these are the parameters where you are judging that this is a good donor or a deceased donor. These are the main parameters.
Okay, so in terms of donor, where does the kidney come from, right? So the kidney will come from either another person. Well, obviously it will come from another person who is either alive or is about to die or has brain death. Now, that is the first is a living donor kidney transplantation. The second one is called a cadaveric or a deceased donor kidney transplantation. In India, cadaveric kidney transplantation even now is not very active or very popular for several reasons. We cannot in a short span discuss those reasons. So for practically most patients who undergo a kidney transplant have a family member who is willing to donate the kidney, and that donor has to be fit to donate the kidney. Should be free of diseases, should have compatible blood groups, preferably should be an adult who is willing to consent for donation, and should not be very old. But of course, even after these initial parameters that have been met, the donor undergoes an extensive evaluation before accepting the kidney.
Sir, like you are having a big experience, like a patient counseling is a major task while a kidney transplantation. So sir, how you are overcoming on that parameter? Like what exactly you are taking care while the transplantation?
So whenever I come across with a patient who is newly diagnosed with kidney failure and now is looking at dialysis for long term, I counsel that patient for a transplantation, irrespective of their financial background. Because why I mentioned financial first is there is a myth that transplantation is prohibitively expensive, and a lot of people don't even think about transplantation because they think that we do not have that kind of money. So I have come across patients who think that transplantation costs them a fortune. They'll probably have to sell off their land or property. It's not so, and transplantation is not that expensive. And when you add up the recurring cost of hemodialysis, transplantation actually turns out to be way cheaper in the long run. So that is a fact that I want to highlight to these patients, and that makes them consider. Secondly, we talk about a feasible donor in the family.
Right.
If they have a feasible donor in the family, then we can go ahead. And of course, finances are not to be ignored. So there are ways and means of coming across, getting beyond financial constraints as well.
So, like, sir, you are saying that dialysis is like a very much expensive as compared to.
In the long run, yes, it is.
Yeah.
See, there was a scientific study done by the PGI Chandigarh few
Okay.
years ago, wherein they have added up the actual cost of dialysis in a private setup. And mind you, 85% of healthcare in India is in the private setup. So patients are practically going to be spending out of pocket or going through their insurance to pay for dialysis. And even insurance penetration is also very poor. So practically patients are paying out of pocket for dialysis. Now, as per that study, and if you also add the opportunity cost, that is loss of employment, etc.,
Correct.
the dialysis can cost around 4,000 rupees plus something per session, and this study was more than 5 years old. So now with that 5
Cost.
years of inflation, this
Correct.
is much more. Even after forgetting the opportunity cost, the actual cost, the money rupees spent for a dialysis, when you multiply that by 3 per week and multiply that by 52 per year, this ends up being anywhere in the vicinity of 4 to 5 lakh rupees per year. And we are talking about a decade or two of dialysis. That is a huge amount of money, and in a fraction of that, transplantation happens. In most hospitals, please don't quote me that this is the cost of transplantation, but on average nowadays, transplantation should cost 5 to 6 lakhs in any good hospital in North India, and I'm sure this must be the case in most parts of India. So that plus the medicine cost and all that comes out to be much lesser in 10 years compared to the dialysis.
I think, sir, you correctly mentioned actually very good point. That is, a cost effective is very much crucial while taking any care, any time of during the medical treatment. Like, there are many companies that are having the insurance and all, but still our Indian patients' mentality is there. Like, they are taking so much and taking a burden of the cost, and they are having the easy shortcuts like going to the other things and all. So in a kidney transplantation, rather going to dialysis, transplantation is a good option. As
definitely, it is definitely a better option.
But sir, there are the many myths and facts are still there, which is having in our Indian patients' mentality. So what myths and facts you came across in your day of practice?
That's again a topic in itself. Firstly, let's talk about the donor myths. People think that if somebody donates a kidney, they also become patient of kidney disease. Well, that is not the point of donation, right? We are looking at donors from the family. So we do not want to make two patients where there was one patient, right?
Correct.
So donor is essentially a healthy person who has been completely evaluated. And if the donor is low risk, if the donor does not have significant risk of disease, only then we are going to accept that. So donor is going to remain healthy even after donation. All right. Then there is a myth that donors will have to also take medicine for life. Nothing of that sort. It's a surgery. So after surgery, you may be taking medicine for a week, maybe 2 weeks. That's it. And then you are back to normal life. Again, now from the patient's perspective, patients think that after transplantation, they will have to be confined in isolation, quarantine, kind of for months to years, which is not the case. I make my patients get back to work as soon as possible, maybe 2 months, 3 months at the max. I want them to be productive. Quality of life improves. Patients think that after transplantation they will be probably suffering for the rest of their life. I explain to them how quality of life is going to get better after transplantation. So these are the myths that commonly come.
And sir, in our not in our country, but everywhere, the people are hesitant to give organ donation, that which will save somebody's life. Okay. So sir, have you seen any data or in your day-to-day practice, after donating a kidney, the lifespan of that donor has came down, or is there any change or something?
No, so there is robust data now available globally about the impact of kidney donation. And what has been found is that in a carefully selected donor who meets all the criteria for donation, the absolute increase of risk of kidney disease is 0.27%, which is less than even 0.5%. It's a very small risk. So that way it is a negligible risk.
Okay.
And anyways, we always advise the donor to be on a regular follow-up. Health checkup should be done, blood pressure monitoring, etc. should be done, so that even if a problem does occur with age, we pick it up early and treat it so that the donor remains safe. So colon donors will remain safe in the long.
Okay. So, sir, in our like everywhere across the world, doctor is known as a healing hand. So, sir, what are the like which is the toughest phase that you have, and the patient has been very well satisfied? Is any experience in one word you can share or something?
Oh well, that has been over the years of my experience and journey. I have come across a lot of cases, but one particular case that I remember from my early days, that was when I was training for nephrology in Ahmedabad, and there was this family, this young boy, the youngest member of the family. He was a teenager when he came to us.
Okay.
And at that time, he had a kidney disease which had been there for around 10 years already, and now it had progressed to kidney failure. They had come to our hospital for getting a kidney transplant. That was what was recommended to him by his nephrologist elsewhere. By this time, they had run out of funds, so they were
not able to afford.
Yeah, they were not able to afford. Ours was a government institute where the director of the institute had a lot of authority to kind of subsidize transplant, and for this particular case it was done 100% free, and the mother had donated a kidney, and this is, I'm talking about 2008. This happened in 2008, and even now, I mean, as of last month, I've been in touch with this patient.
Okay.
Who is doing fine. His kidney is now okay, the mother is fine, the sister who takes care of this boy now is no longer a boy anymore, but they're all doing fine and they're so happy, and it's a touching story. I mean, we were able to change
the life of the patient.
Yeah, and that gives immense satisfaction. That is the power of transplantation, basically.